Warm greetings to our esteemed Fogsi President, Dr. Sunita Tandulwadkar, and our distinguished guest, Professor Dr. Hemant Kulkarni. A very good evening to one and all. I extend a heartfelt welcome to the ever-growing audience of Gyan Pravah, the podcast series. We are thrilled to have participants joining us from across India and around the globe. Welcome to episode 247th. Brought to you by the Clinical Research Committee of Fogsi under the dynamic and visionary leadership of Dr. Sunita Tandulwadkar, President Fogsi 2025. Wishing you a happy Navratri. I am Professor Dr. Surika Taide, the Chairperson of Clinical Research Committee of Fogsi and your host for this evening. It is my distinct pleasure to welcome our guest speaker, Dr. Hemant Kulkarni, whose insights will enrich today's conversation. We are about to delve into a topic of tremendous relevance in today's era, innovations in medical research, AI-based technology. It is my distinct pleasure and great honor to welcome and introduce our very own President of Fogsi, Dr. Sunita Tandulwadkar, a visionary, a trailblazer, and a true architect of transformation in women's healthcare. In research, we talk of transformational research and translational research, but Dr. Sunita transforms lives itself. When most people see obstacles, Dr. Sunita sees blueprints for transformation. She has the rare gift of converting a spark of thought into institutions, initiatives, and movements that outlive the moment and serve generations. Whether she is bringing India's first stem cell baby into the world, amplifying voices through her Gyan Pravah podcast, reshaping preconceptional care with the Sampurna initiative, or training thousands of young doctors under the Eagle Project, her work is never just about medicine. It's about rewriting what's possible and also what is not possible. She is an IVF pioneer, a surgeon par excellence, an author, an editor, and a thought leader whose influence travels far beyond operation theaters and lecture halls. Yet, ask anyone who has worked with her, and they'll tell you her true legacy lies not in the accolades she collects, but in the leaders she creates. For me, introducing
I'm feeling very awkward. Please, it is your day with Dr. Hemant, and you always have a overwhelming words for me. I don't know whether I deserve all these words, but Sureka, thank you so much. More than those words, your love and the respect, that matter to me a lot. So thank you so much, Sureka. Thank you. I have to stop you.
Madam, you have been my mentor and mentor to all of us, and you have been mentoring us to be leaders. So all this comes from my heart. Over to you.
Thank you so much. Thank you, Sureka. See, Sureka, all the committee chairperson, Dr. Hemant Kulkarni, first of all, welcome on Fogsi platform. It's such a great honor to have you, and we are thankful to you for taking out your valuable time sitting in different part of the country at different time zone, but being so fresh and being with us. Most importantly, these committee chairpersons, I have a 30 chairpersons, and 30 days they gave 30 podcasts, which is going on. This is 9th month we have completed 200 plus podcast. It's beautiful journey. While starting this journey, we never knew how it will be, whether it will be useful, whether it will be worth doing it. But believe me, every day, 8 p.m., having such a leaders from all across the globe and giving us such a beautiful dialogue, my chairpersons, they are coming out with their leadership, their creativity, their passion, their enthusiasm. It's overflowing. And that's why every podcast of each and every one, every month is evolving to the sky high level. I don't know, at the end of 365 podcast, what we are going to do with this intellectual property which we will be collecting on the Fogsi platform. But definitely Sureka, being a research mind, she will come out with something out of the box ideas, and I'm sure we will be able to do that. But today I will be joining the viewers link to listen to both of you. And knowing Surekha, I know it will be a fantastic podcast, the dialogue between both of you, and it will attract the whole viewership from my Foxy. Thank you for being here. And thank you, Surekha, for always choosing out of the box faculty. Thank you.
Thank you so very much, ma'am. And thank you for being with us and mentoring us.
Thank you.
I take this privilege to introduce Dr. Hemant Kulkarni, a highly respected academic leader, researcher, innovator, and an artist. Dr. Hemant Kulkarni is a professor of public health genetics and genomics at Texas A&M University, San Antonio, Texas. He also co-owns with his wife, Dr. Manju, the M&H Research, a research consultancy company in USA. Moreover, he has led the Lata Medical Research Foundation, a non-governmental, non-profit organization in Nagpur, Maharashtra, as president and founding trustee for the past 25 years. Dr. Kulkarni received his training as MBBS MD, but has autodidactically contributed to biostatistics, epidemiology, and biomedical research methodology. He has published more than 150 research papers in high-impact, peer-reviewed journals, including stellar journals like Science, Nature Medicine, Nature Immunology, and PLOS Genetics. He has published widely in the field of HIV, cardiovascular diseases, type 2 diabetes, and other metabolic conditions, infectious diseases, including COVID-19 and tuberculosis. His current interest in healthcare research revolves around the application of artificial intelligence to healthcare problems of importance. He has nearly a dozen publications on various healthcare applications of AI, most of which demonstrate his interest in using novel, non-invasive diagnostic technology for diseases of public health importance. Apart from his work, he is a renowned singer, especially in the ghazal genre, an astronomer who leads an astronomy club, a passionate chef, and a torchbearer of Indian culture in the Indian community in San Antonio. We are very, very privileged, sir, Dr. Hemant, to have you with us in today's podcast.
I don't know how to thank you, Surekha, for this expletive. This is excellent introduction, more than I deserve. And I am also sure that my contributions have been, very minimal to the field of science and AI especially. But it is your magnanimity that has reached out to me and invited me to be a part of this. And Dr. Sunita, thank you very much also for your welcome and introduction. I am also looking forward to this dialogue, and let's see how it goes.
So thank you, ma'am.
Looking at your entire biodata, what she has said, you are doing amazing work here. These statistics and everything is the work which we can do 10 deliveries in a night, but we can't do all this, which is so much essential. So I'm sure this will be a guiding force to all of us. And being a best chef, I think your wife must be very happy. She has to enjoy and whatever the dishes you can cook in. Looking forward to see you sometimes. Can I ask you which part of the Maharashtra you belong to?
I graduated and did all my medical in Nagpur, Maharashtra. So most of my stay has been in Nagpur. I did my 11th, 12th, and earlier schooling in Amravati, so it's in Vidarbha. But I was born in Belgaum, Karnataka.
Madam, I'm proud that he's from Amravati, my native town, and he's from GMC Nagpur. We are alumnus of the same institute, and we are really proud of him. The amount of work he does, and he's a great singer. You should listen to his.
That's what I asked him. Maharashtra ke kaun se part se ho to have a singing as one of the hobby. So lovely, and enjoy your podcast.
Thank you very much. Thank you. Very sweet of you. Thank you very much.
Thank you so very much. So now Let us begin this wonderful discussion. Dr. Kulkarni, can you briefly tell us about your journey in medical education and biomedical research especially, and what inspired you to focus on genetics and public health? And how your experience at the University of Texas and other research institute shaped your approach to integrating AI in medical research?
Thank you, Surika. First of all, again, congratulations for leading this brilliant initiative. 247 means your podcasts are actually nearing full term now. So we're just getting there. And I really wish you all the luck, you and Fogsi, for all the best wishes for completing this brilliant initiative, because it brings in people from different perspectives together on a single platform and helps exchange the ideas. Regarding your question or questions, they are like layered questions. So let me take a few minutes to explain where I come from and what my interests have always been. Even while I was in the medical, like when I was doing my post-graduation in Nagpur, during that time also, I was always interested in research. So the two choices I had for doing post-graduation based on my performance in the examinations were pediatrics and community medicine. Now, both are excellent disciplines to go after, but at least at that time, my understanding was that doing a post-graduation in community medicine will help me do more research, because pediatrics is a more clinical branch. Of course, there's great researchers in pediatrics too, and in any clinical discipline. But my own inclination was more towards, biostatistics, epidemiology. I love those topics, and it helped me understand all aspects of science, irrespective of discipline. So I remember in those days I used to help postgraduates from other departments in the medical school to complete their thesis and their dissertation topics, and I got to learn a lot about each clinical discipline, because the common point of all was biostatistics, epidemiology, application, interpretation of data, all that. So that's why I was always interested in this field. And so I took community medicine, and that really helped me foster and pursue my interest in biomedical research in general. Now, having worked in the field of research opened up one of my desires, which you already mentioned in the introduction too, which was to help other medical students who at that time I thought were not very well initiated into the field of research, to really initiate them, or at least introduce them to the concepts of research. It so happened at that time that I was fortunate to work with some of my students. I've always been blessed, by the way, with brilliant students. So, and GMC is one such rich pool of brilliant minds that has always helped me learn myself. With those students, with the blessings of my mother, I founded the Lata Medical Research Foundation, which was initially the idea being to help medical students, get into, or at least understand, the principles of research. When I did that, I came across and it gave me an opportunity to work with some people who later, spread out to different parts of the world. So one of them happened to do his postdoc here in the University of Texas at San Antonio, Health Science Center at San Antonio. And he, because we were very close, he happened to mention my name to his supervisor. the supervisor called me up. They were working on this. At that time, HIV was a big deal, so they were working on some host genetics of HIV, and they wanted some analysis done. I was in India, so they gave me their data. I worked on their data. We published a paper which was published in PNAS. And so then he thought, that supervisor, that there's no point in you working remotely there. Come, I'll offer you a faculty position. Come here. So I came as faculty, no USMLE, no nothing, just happened to be associate professor
Wow.
in the Department of Medicine.
Absolutely wow.
So, so then I landed here, and now gets to the second part of your question, how these universities have helped me shape my interest. I must at this time mention a little fact that, you know, it was, I think, 1990, the year 1990, when I was like freshly off of my post-graduation. I was working as a lecturer at that time in Government Medical College. Dr. Chaubey was the dean at that time. And we used to have these faculty research presentation meetings where all faculty across clinical departments, clinical, non-clinical, paraclinical departments used to come together, present their data now or research. At that time, artificial intelligence was in its very nascent stage, but I was always interested in those days. In those times, there was a subfield of artificial intelligence called as expert systems. So the logic is that we clinicians, especially, we tend to make heuristic decisions. So the decisions are based on logic. If this is the symptom, this is the sign, you know, we make sense of those, and then we come to our diagnosis or treatment plans or whatever. So such a system that uses these logistic heuristic rules was called at that time an expert system. So because I was interested in this field, number one, because I was blessed with a father who was professor of mathematics in an engineering college, and a younger brother who did his IIT PhD in computer vision from Powai. My inclination has always been to this field. So at that time, I had written an expert system to decide the treatment of primary hypertension, and I presented this topic in that meeting, I remember, and Dr. Chaubey was very excited about it, but at the same time very guarded about it, because he said, after all, human intelligence is what really matters. Howsoever much your expert systems can work, there's no way they're going to replace our clinicians. He used to say that clinicians, an expert clinician like him, he said, when I go for a vacation and come back, for the first couple of days, it takes me a little while and effort to distinguish between heart murmurs. So, someone who had that ear would still do. I mean, we need a lot of practice. So the point of telling this was that my interest was always in artificial intelligence related stuff, even before I came to the US. But having come here, and especially having worked at the Texas Research Institute, Biomedical Research Institute, I worked with a world leader in the field of statistical genetics. His name is Dr. John Blangero. And John is a phenomenal scientist and a wonderful human being. And it was so much of a pleasure to work with him. The first thing that attracted me, and that he used to boast also of, was what volume of data we deal with in genetics and genomics. We're talking about 3 billion nucleotides on one person, and so we have data on thousands of individuals. So to crunch that data, even to store that data, let alone crunching it, we need big computer systems. And the system that we had at that time had 8,000 computers connected with each other. and 8,000 computers let us, we call them cores at the time. So 8,000 cores, we could parallel process all this data, and what can take something like 2 or 3 weeks to analyze, we used to do it in like 2 hours, 3 hours. So that also in kind of instigated me into the field of artificial intelligence. But the real push that I think my career got in this direction was because of the general interest of in the field of artificial intelligence that is explored in the past couple of decades. And that has actually happened primarily because there's a lot of data available now. In earlier, when we used to do clinical studies, 200, 300 patients is like big deal. 1,000 unheard of. But nowadays, you look at these papers, it's like 100,000, million people, 2 million for training, 1 million for validation. I mean, it's like just amazing.
I know.
So that data has changed, exploded this field of AI, and it just swept me off as well.
Dr. Hemant, our generation, we have come from, when we typed our theses, you remember,
Yes.
from GMC Nagpur, we didn't have computers. Neither we did have any internet or Google. Emails came in 2000 or something, and before that we have already finished our theses and post-graduation. So it's great to hear from you. I know, I have been hearing about you since my undergraduate days. I saw you as, I used to be in awe of you, because having a research interest was not considered, it was considered ki thoda pagal hai type ka, on this call. But now, when you talk of genetics and how it has affected the diseases, the AI, we now know that everywhere we have now AI, and it's got into each and every discipline. And it is playing such a huge role in healthcare and non-communicable diseases, infectious diseases. And in our times, we used to have, the theses of only 200, 300. Now, as you rightly said, huge amount of data is there. And with AI, we are able to come out with something that will work for society. So that brings me to the next question. AI is now the buzzword. How do you think these technologies are transforming the biomedical research arena?
Fantastic question. And again, the answer is likely to be quite layered. So the thing is that, like rightly you said, there's not a field of medicine, biomedical research, finances, arts, anywhere. There's not a field that has been not touched by artificial intelligence. The applications are just overwhelming and all-encompassing. But in terms, specifically in the field of biomedical research, the kind of projects that I do, and the kind of projects that really the world does are primarily focused into a few key areas, like diagnostics. Now, diagnostics has become a big, has kind of reaped its fruit very richly off of artificial intelligence. Not that clinicians were not able to diagnose diseases early. Of course, they were brilliant clinicians. And in the absence of artificial intelligence, I thought that they were more brilliant than what our generation or the younger or the Gen Zs are going to be ever. But because they relied on interpretations, observations, and logical conclusions, we are driven by data and outputs. But diagnostics, what AI has done is it has looked at problems in different ways than traditional clinicians used to do that. Novel insights into how things can be done. and more importantly, very high accuracy. So, these systems are really, really very accurate. And in fact, the Mayo Clinic published a study, very interesting study in the field of OBGYN, actually, that they came up with 60 MCQ type questions, a battery of 60 MCQ questions, and these related to different scenarios in OBGYN. And so they had 24 residents, and these 60 questions were given to those 24 residents. And they knew, the investigators knew, it's called the PERFORM study that I'm referring to. The name of the study is PERFORM. And then they also gave it to 8 different LLMs, like ChatGPT and Gemini and things like that. And so then they compared what residents, how residents fared against the LLMs. And it turns out that the LLMs had an overall accuracy of 73% in answering those 60 questions, and the residents were right in 63%. So about 9% better the LLMs were. That's one. And then our readership can, or our viewership can see that paper. It's a very nicely done study. But that's just one example where AI is really helping the field. The other is drug discovery, because the field of drug discovery was a very tedious procedure earlier on. Design a molecule, test that molecule, do the studies, go back. If it works, it works. It doesn't. And even to get to the point of FDA approval, the things were very, very lengthy and difficult, and then costly. But with this AI approach, there's a lot of in silico studies that you can do that do not require actual experimentation, but can accurately tell the most likely or the most predictive molecule that will work, how it will dock, things like that. So that is another area which is definitely enriched by AI, and then other things, trial design, for example, optimization of the trial RCTs. This is epidemiological design of the RCTs. Everywhere you will see that this is helped tremendously. So wide spectrum of applications, and all of them doing a great job. My
Yeah.
personal favorite though is diagnostics.
Absolutely. Actually, when you are talking of this, comparing the medical students versus the LLM, just yesterday I was having a dialogue with undergraduate students who wanted to do some research, and they said they wanted to prove that medical students using ChatGPT for diagnosing their own illnesses, they wanted to prove ChatGPT wrong. I said, no, that is the worst kind of research you're going to do, because if you're going to compare ChatGPT with experts, even professors, of course, clinical examination and all that data, if you feed properly, the prompts are very good, then we will have almost an equal or a better outcome with ChatGPT like, or Gemini like, expert AI systems. So you're very, very right. But yes, of course, the prompts have to be very good when you're using all these AI systems. So there is a training, little bit of definitely that training is needed when we use the AI system. But the kind of use we are going to have of AI systems in the future, we can't even imagine. Where it is going to penetrate and how it is going to help, and definitely it is helping, like drafting proposals, if you're going to talk about statistics, how to go about analyzing a data, everything that these AI systems are giving you, and such a short period of time it is using, that is saving a lot of time for the medical researchers.
I agree,
But
totally.
it's a huge asset, I think so.
Very
And
true.
again, I would like to know from you, you have given very specific examples, but your own fields like the cardiovascular, diseases, then HIV, diabetes. I wanted to know how are there some specific applications for diagnostics as well as drugs to these, very important diseases or disorders?
Yeah. I personally have worked in the field mostly of type 2 diabetes, and that's because Manju, my wife, her interest has always been type 2 diabetes. So she and I have worked in this area. Now, there was a coincidental thing that happened. Our work here in the field of type 2 diabetes genetics is primarily in the Mexican American populations. Because we live close to the south border of United States, and we have a lot of access to this Mexican American population, which has migrated from Mexico into the US. I had the fortune of working with John, I said earlier, and others in that field who have conducted big studies and like thousands of Mexican Americans, and these studies actually used a family study design. So what that means is that we do not enroll the patients directly from population, but we enroll it from within families, because within families, when you do genetic studies, you're likely to see to get a better handle on the rare variants than the common variants you can study across populations, but rare variants you'll need these family studies. So we have like 4 or 5 generation families included in these studies, and we have like 6,000 people in them, big studies. So inspired by that design, Manju and I started a study in India about 10 years ago. This was in 2016. That we initiated the project. We collected the data in 2018, and this study was in Nagpur. And Manju being a Sindhi, we know that in Sindhis they have rich diet. They have limited, I mean, not labeling anything, but in general, by history, the professions have been not very supportive of physical activity, and also there is genetics. So we wanted to understand if there is a genetic basis to it. So we conducted a study called the DISTIN study, which included 1,400 Sindhis from about 150 families, and this was a type 2 diabetes study. And then while doing that study, we also did something that was on my mind for a long time. We recorded their electrocardiograms. And my hypothesis has always been that the ECGs will be a good non-invasive predictor of type 2 diabetes status. Why? Because there's at least 3 mechanisms that I can think of. One is direct structural changes in the heart. We know cardiac fibrosis happens and things like that happen, which will definitely change the electrical properties of the heart. That's one. The second is we know there is a condition called CAN, cardiac autonomic neuropathy. So when that happens, obviously electrical properties will change. And the third thing we know is that the glucose transport into the cells is regulated by the co-transporters of sodium and potassium. And therefore, potassium imbalances especially, those electrolyte concentrations will have something to do with type 2 diabetes. And we know that as potassium imbalance happens, so do the electrical properties change. So my hypothesis was that ECG should be predictive of the type 2 diabetes somewhat. So we did a study. In this study, we collected 10-second data on ECGs, and then we did a machine learning study on that and asked it to predict three classes: type 2 diabetes, pre-diabetes, and no diabetes. And we got 97% accurate results. And that paper got a lot of press. We got discussed at various forums. So in general, things like this, non-invasive methods. Another example I wanted to give was that of one of my friends who is a nephrologist at the University of California in San Diego. So he came up with the idea that because renal biopsy is a very invasive technique, and not all CKD patients undergo renal biopsy, but every suspected CKD patient undergoes ultrasonography. So he said that, is it possible for us to use ultrasonographic images and predict the degree of in kidney? And we got 90% as well. So to put it in short, these are just a couple of applications, but there are such a wide spectrum of applications.
Absolutely.
I'll conclude the answer by giving one more example.
Yeah.
And that is that we conducted a study also in Nagpur on a cohort of 1,000 pregnant women. And the primary idea being able to predict gestational diabetes in them in their first ANC visit itself. So the first ANC visit that we usually the recruitment was done way before 20 weeks, and in fact the average was 16 weeks in these women. As you know, the diagnosis of this GDM occurs pretty late in pregnancy, like 24 to 28 weeks. So we wanted to see if during their first visit, like about 2 months ahead of the actual diagnosis, is there a way to do this, predict them? And we did their ECGs at that time.
Okay.
And lo and behold, that paper is under review right now, so I can't give more details. But we have a very high accuracy of predicting the possibility of developing GDM around 3 months earlier using ECGs.
Wow, this is absolutely wonderful to listen to, all this work you have done, and especially in diagnostics. I must tell you one example from MGIMS, where my husband is working as a radiologist, and they are working on an AI tool, which will help diagnose tuberculosis. As you know, tuberculosis is still rampant here, and specifically to pick up those cases which are missed by the clinicians. As you rightly said, the more we develop this AI, the more accurate those models are to diagnose these conditions, and rightly in a non-invasive manner, and maybe weeks or months ahead before the clinician able to diagnose, as you're rightly given so many nice examples. And I hope now in the near future we'll getting that AI tool to diagnose tuberculosis as well. And it's wonderful to know about the pregnant woman, and we are able to diagnose GDM so early. I think it would be a very good tool for diagnosing, for interpreting in infertility as well,
Exactly.
trying to predict which women will respond better to your treatment, and which kind of treatment to begin. Because now I have got into IVF, so that is my area of interest also. It's very nice to hear about all these examples, but I think there must be some challenges as well, when you are trying to use these AI models. So can you, talk of your experience about what challenges you have faced with these AI models?
So the biggest challenge, I think, let's imagine that we are teaching a group of 200 students. So these AI models are nothing different than the students. That's why they're called training. We train them. Now, whenever we train anybody or any machine learning algorithm or any method, garbage in, garbage out. If we give wrong data, if I'm a bad teacher, my students are going to be bad. What I teach is very important. So this the
Absolutely.
biggest challenge, I think, is to find data that is accurate, data that is voluminous enough for these AI models to learn from. See, there's a big difference in the way we learn versus these models learn. Uh, Take the example of a 5-year, 6-year-old girl, boy, and they're observing their parents and they're learning. Nobody's teaching them anything. They're just observing their parents. They learn from that. But these machines, they cannot do that because they're not inherently intelligent in all aspects of the world. So we need lots and lots of data, which is a big challenge. Now, with so many, forums and so many collaborations that are happening around the world, we are putting together repositories that are really good. And that's why, like I said earlier, that's the reason why AI has exploded. But that still remains, especially for, rarer conditions or rarer variants, it becomes a problem to get that level of data. That's one. Number two is the quality of the data. Like I said, it's garbage and garbage. If it may be a lot of volume, but it may still not be a good quality data, and the machine is not going to learn anything. All those things that are related to training and the requirement of computational resources. This ChatGPT 4, I actually asked ChatGPT this question. Can you tell me how much it costs to train you? And ChatGPT said that the OpenAI would not actually disclose the number, but based on my research, it turns out that ChatGPT 4 required between $40 to $78 million for training.
Oh my God. Okay.
And the more complex the model, the more it is. So when they start training, they have to be very careful, because if you do make one mistake, it's
I
a
know.
loss of, $30-40 million down the drain. To
That,
restart everything. So it's very
yeah, that
computationally
gives,
risky.
me another question. As you
Yeah.
said, the right data has to be filled in. Feed it to the AI models. I'm doing, Dr. Sunita Tandulwadkar is leading this research on preconceptional care, and I am the, coordinator for 50 sites across India. These are medical colleges and district hospitals and public hospitals, 50 sites where we are going to train on preconceptional care and then perinatal mental health, those kind of research we're doing. So does AI help in, collecting and feeding, not collecting maybe, but feeding the data to the systems as well? Because that is where we are having a challenge. So I wanted to know, after feeding the analysis, I can understand, but can AI help in that too?
Theoretically, yes.
Okay.
But practically, there's one question that comes to my mind is, if the AI system is going to pick and choose data that it thinks is good, then obviously we're biasing the model, because that's not what
Yeah.
the reality is.
So there the human touch is
Yes,
important.
exactly.
That's where the
And
humans are coming in.
true.
Everything
And
cannot be
there
done by
will
AI.
Sure.
Yeah.
There will be many situations in which AI models will have to be trained using realistic data. It doesn't matter if they are less accurate, but they have to be more useful. So to make that happen, the data has to be, kind of real world representative.
Okay. So how are there any ways to remove these biases? As you said, that AI will become biased, and so are there ways and means of making AI more accurate and unbiased, especially in medical studies? Briefly, I would like to know.
There is a quote that says that expert is one who knows more and more about less and less. So these AI, especially this agentic AI that has now come up as one very popular field or sub-branch of artificial intelligence, is the one which is trying to solve specific tasks with high accuracy. So there will be a very specific problem that one can think of, like if you want to differentiate between carcinoma in situ versus other grades, higher grades. Just taking that specific task and then developing an expert system or algorithm for that, AI algorithms. This is a task specifically designed for a very small one. So it's designed to be biased. Versus when the earlier models or many of these models, image classification models that have been developed, they have been developed on simple data sets, millions of images, but all they want to classify is this a car, is this a person, is this a cat, is this a dog, things like that within that image. Now, if I take that model, which is a very broad stroke model, and ask it to predict whether there is, hilar infiltration in a lung chest X-ray, it's going to find difficult to do that. It's just like asking any lay person to try to give them an X-ray and ask them to, predict what it is. It's not going to happen. So we either design AI models that are specific to tasks and then have so many multitudes of them that we don't know how to combine them. Or we, on the other end of the spectrum, we have more broad spectrum, things like chatbots, which are going to be very popular very soon, which can, schedule an appointment with the doctor. You can do the initial screen based on your symptoms and all, things like that. That will help a lot. But if you want to do, high-level diagnostics, that's not for every chatbot to do.
I know that has to be very specifically trained AI system. Absolutely.
Yeah.
So, if you look down the line for the next 5 to 10 years, what do you think are the biggest opportunities in AI, especially in the healthcare field?
One thing is, and you had mentioned this earlier, LLMs have become kind of pervasive now. Everybody wants to go ask ChatGPT. It's kind of replaced Google, because Google used to take us and leave us in a jungle. This is a one step better than Google. But I personally think that LLMs, howsoever successful they are not the way humans think. LLMs are okay the way machines think, but not the way humans think. So in terms of opportunities for AI, I think one of the biggest opportunities is to make models that rationalize. As of now, we don't have rational models. In fact, there's now a big branch of AI that's coming that's called explainable AI, where the machine has to be able to explain how it diagnosed what it diagnosed. But it's not happening very clearly. Right now, all these machines are like black boxes. We should put some data in, it'll throw some output, generally which is accurate, but we don't know what it did, how it came to that conclusion. So the biggest opportunity for AI is making rational or intuitionally, logistically explaining models. That is currently lacking. And if that happens, that I think will really mirror the human intelligence. It's still not going to replace it, but it will be it will be closer to that, and therefore more reliable than the current models.
So as these models are coming up, Dr. Hemant, we are seeing use of ChatGPT, Gemini, and so many other, even there are now AI systems to help us with systematic reviews and meta-analysis, so many things. So what kind of advice would you like to give these young researchers or clinicians who want to integrate these AIs into their work? Specifically, would you like to, advise them about what things to be aware of when we are using these AI models?
When Sigmund Freud described his theory of psychoanalysis, he gave a very good example of how mind should be. He said that our mind is like a rider on a horse. Now it's up to us whether we ride that horse and let the horse take us where it wants to go, or whether we hold the reins and we direct it to go to the pond or to wherever. It's the same with AI. In AI models, we have to be very critical of anything that we use, and we do not use it as a master, but we use it as a tool. We cannot ask a question of ChatGPT and believe whatever ChatGPT came back with. We have to use our rational brain to make sense of it, and then only believe this. So, if you are looking at integrating AI models either in your research or in your clinical practice, I don't think I'm on that pedestal to be able to advise anybody anything. But what I think is that as long as we're using these AI models as tools, we're good to go. The moment we start depending on them or treating them as masters, we are
Absolutely.
we're not going to be useful to
I
even
know.
ourselves.
Even ChatGPT itself, has that disclaimer that
Yeah,
you need to, ChatGPT doesn't know everything, and
yeah,
ChatGPT may be wrong. And many a times we find we really have to, experts and even, general public also need to be aware that
yeah.
ChatGPT may not always be right chatbots. In fact, recently I went through some news about ChatGPT, psychologically, especially the teenagers, vulnerable people who have loneliness, they are so much dependent on ChatGPT or other AI models for their psychological and mental health that one of the teenager committed suicide because of the type of the discussions was having with the chatbot. So regarding all this, and of course we are talking of research and healthcare as well. So are there some ethical concerns when we are using these AI systems with our huge data which we are sharing with them and the type of interactions which we have? So are there these ethical concerns which we should be aware of when we are using these systems?
Absolutely. I mean, the ethical considerations in AI is a big can of worms. It's a big field in itself, and all of those, of course, cannot be discussed within a 5-minute, 10-minute answer. But I'll just give you a simple example. There was a study from China where they used facial features to predict the risk of cardiovascular disease. So all they did was they had images captured of the patients. They knew the cardiovascular outcomes in them, and they developed a model that looks at these features and comes up with it. Now, imagine such a system deployed on a railway station, for example, or at an airport, and it's collecting facial data on people and predicting. Now, one would think that this is an excellent system that is so non-invasive, so accurate, and so well-meaning. But that well-meaning is not enough. Imagine how those facial features can be misused in million ways. Apart from the fact that it can be used directly for ID theft or things like that. So all our tools, and this is a problem with science in general or technology in general. Nobody invented the nuclear power to be a bad power to use, but the way we use is what defines us. Artificial intelligence is no different. It is defined and devised for good purposes, but humanity is humanity. It will use it in ways that it was not designed for, and that's where the care or caution is really required.
I know. I mean, if you look at this topic, it's very huge. On the one side, we have all the plus points of how it will be helpful and how wonderful it is for healthcare, drug discovery, personalized care, so many things. And on the other hand, that is that arena that which we don't know what is going to happen in the future, how the AI is going to develop itself. Even we are not able to predict. Even for that matter, Google, they will trace our footsteps, footprints, where we went, what we did, and we don't know where this data will be used. I think these are things maybe over the years, or maybe the science will tell us, or sometimes we will have some pitfalls as well, mishaps as well, when we are using these systems, and when, of course, we will come out with solutions, but we really have to be wary of technology, how we are using it,
Absolutely.
where we are using it, and the ethical part. I think humans will have to have some guidelines on how to use and how much to use this kind of systems. I think this is a huge topic in
I just
itself,
wanted
Dr.
to say
Heyman.
that, I just wanted to say one more thing, that the process of regularization or legislation is always, a step behind, because things happen and then we make laws. And so to that end, howsoever, well created our legislation may be, it will still have, some distance to go before we can actually be very sure or assured in our chairs and say that AI is only being used for good things. But yes, thank you very much.
Yeah, thank you. Thank you so much, Dr. Hemant. As we conclude this insightful episode of Gyan Pravah, I extend my heartfelt gratitude to you for sharing your expertise and shedding light on this critical arena of innovations in medical research, specifically the AI technology. And a special thanks to Dr. Sunita Tandulwadkar, our president of Fogsi, whose visionary leadership has made this platform a reality, transforming discussions into actions and fostering meaningful changes in healthcare dynamics. To our audience, thank you for tuning in and being part of this journey. Your engagement and commitment to advancing healthcare drives us forward. Stay connected for more thoughtful discussions in the upcoming episodes of Gyan Pravah. Until next time, let's continue to learn, share, and empower. Good evening and take care. I, Dr. Sunita, Surekha Taide, and Dr. Hemant would like to sign off. Thank you.